What is going on, people? We are on the respiratory system. So, slide in front of you. We could divide this into the upper and lower respiratory systems. That happens at the epiglottis, which is somewhere around here, like right where this line is for larynx. So above that is the other upper respiratory. Below that, lower respiratory. Usually when it's lower respiratory, like in practice, we're thinking the bronchi down here, the lungs. That's kind of what what you're thinking of when you think of a lower respiratory infection or something like that. All right, so so there you are. Pharynx, mouth area, mouth nose area, the nasal cavity. So you have the nasal cavity, the pharynx, the larynx, which is your voice box, and then trachea, and then you have lungs down here. So let me go to another slide. Right, so this is your nose. These are called nares, nostrils. You don't need to know, as far as I'm concerned, all the bones and parts of the cartilage. I mean, that's something you should have had in A&P 1. Just so you can see that you do have different types of connective tissue here. You have bone, adipose tissue, and cartilage all in the same area. Okay, here we go. This is a opening of the mouth. Again, this is the anatomy of it, where I'm usually concerned with the physiology of things. But there's your tongue. It's kind of big here. So let's start with the nose and go down. These are called conchae like shells, like a conch. Sometimes also referred to as turbinates. They just kind of keep the area of the inside your nose moist. Then the pharynx, it's divided into 3 areas. So look over here to the left, and you can see it's color-coded. Right, so you've got the nasopharynx, the oropharynx, and the laryngopharynx. Right, so you can kind of see where it is here. So the nasopharynx is up here. There's that hole right there, and if you follow that, it leads to the eustachian tube or the auditory tube that is connected to your ear. This tube in us, between the nasopharynx and the ear, is kind of slanted up. So, but in kids, it's more horizontal. Couldn't think of the word. So it's more horizontal in kids, and that's kind of why when kids have like infections, it kind of spreads. It could spread more easily to the ear. Not that you're going to be tested on that, but so nasopharynx. Here's the oropharynx. This space right here between like the mouth and the nasal passage is called the fosses. So this is all the oropharynx. Laryngopharynx down here, down this area. And so right here is starting the larynx. So there are some tonsils here. So you got your palatine tonsils. So if you look into the back of your throat, you see the uvula, and the palatines are kind of on both sides of it. Those are the tonsils that sometimes get hypertrophied. So then you have lingual tonsils, and your third set is the pharyngeal tonsils up by the auditory tube. So you got 3 sets of tonsils. Here's the larynx, and we have another slide on this, but just right here is the trachea, and this is the esophagus, and this epiglottis is the top part of the part of the larynx. And so I think you have your trachea, and the epiglottis is going to close over the trachea. Actually, when you swallow, your whole if you feel your larynx, that's going to move it's going to move superior, and then that's going to close the epiglottis over the trachea, and that's going to force the food down the esophagus. And the uvula, the dangly thing in the back of your throat, that is closing up over the nasal passages so that food doesn't go up. We will talk about that again when we discuss the digestive system. So let's take a look at there you go. So I kind of wrote it out. What's in the 3 parts of the pharynx. Okay, here's both an anterior and posterior view of the larynx. You can see the epiglottis here at the top. You see the hyoid bone, the only bone that doesn't articulate with another bone. The main Adam's apple, that main cartilage, is the thyroid cartilage. If you feel for your Adam's apple, and then you'll feel like a depression, and then you feel the next cartilage. That's your cricoid cartilage. And in between your thyroid cartilage and your cricoid cartilage, as you see, is the cricothyroid ligament. That's a spot where people could do an emergency trach. In the hospitals, they will put a trach in your somewhere in your trachea, so that'll be like a stoma, right? In the field, like in outside of hospitals, they might try to put it in the cricothyroid ligament because that's as you see, it's a bigger piece of cartilage there. You notice that so here's the beginning of the trachea, and so you notice these rings don't go all the way around. So that's because the esophagus is right behind the trachea, and the esophagus sometimes needs room to expand into the trachea. So when you look, I think I've got a slide on this. Hold on. Let me skip past this, and I will go back. So here we go. This is like a slide of it, right? And so the esophagus, you see, is rather flat. It's a transverse section. The esophagus is rather flat, and so you see the hyaline cartilage here is kind of like a C-shaped, so that this esophagus can kind of gives it room to expand a little bit if it needs. Let's talk about I'm going to skip this one. The other part of the larynx here is voice production. So here, the white, you have 2 folds in the larynx. So you have true vocal cords and false vocal cords, or vocal folds and ventricular folds. So the white is the vocal cords, and then this area out here is like the false vocal cords. And so what those do, the ventricular folds, is like if you're gonna like breathe in, take a breath in, and then hold it, like anticipation that someone's gonna like punch you in the stomach or something. You're like pushing it down. That's what your ventricular folds are for. The vocal cords are going to produce sound, right? When they come closer together, the pitch goes up. Further apart, the pitch goes down. If you look over on your left, you see that these are primarily controlled by 2 sets of muscles, the posterior and lateral cricoarytenoid muscles. And so when one contracts, brings it closer together, the other contracts, pulls them apart, and that changes your voice. So trachea, about 1 inch in diameter, about 12 centimeters long, and there's layers of the trachea. So we're going to start on this slide. I'm starting it from the most inner layer, going from deep to superficial, right? And definitely when you see the word mucosa, you're already thinking like the lining of something, right? So if I say mucosa of your stomach, you're thinking lining. You're thinking like the first layer, right? Or the mucosa layer of your esophagus, mucosa layer of your trachea, right? It's going to be the lining. So whenever you see that word mucosa, that's what you're thinking. So it's the only place in your body where you find pseudostratified columnar cells, at least for humans, right? And so you notice here it's pseudostratified. That's not so important. but it's ciliated. So it's got little cilia. And I think we talked about this last chapter, but the cilia push. So when you breathe in like dust or something like that, they'll like push the dust up far enough so that you can clear your throat. Submucosa is, as the word implies, the layer underneath that, and that's where you would find mucus glands, and then you have hyaline cartilage, anywhere from 16 to 20 rings. They're like those C-shaped rings. The outside, the most superficial layer, we call that adventitia. So often we call it, like the outer layer would be called serosa, but if it's connected to something else, they call it adventitia. So in the case of the trachea, it is connected to something else. Behind the trachea is the esophagus, and it's connected. Like if you were to look at a cadaver and you were just to grab the esophagus or the trachea, the other one comes with it. You have to kind of like tear them apart. I know it sounds disgusting. So here we go with kind of like the order that air passes, right? So it's coming in your mouth or your nose, into your pharynx, down past your larynx, into your trachea. So I'm following this bronchial tree right here. And so right here at the bottom of the trachea, you have like can't really see it here, but it's like a triangular shaped cartilage called the carina. And then it's going to bifurcate. It's going to split to a left and a right primary bronchus. So it's just right there. So there's a primary, there's a primary. And the primary are going to split again. Now, look at the lungs for a second here. Notice that they're lobed, right? It's not just a left lung and a right lung. No, there's three lobes on the right side, and there's 2 lobes on the left side. This is, see this little notch right here, cardiac notch, that is for the apex of the heart. But they're lobed, right? So you could, one lobe can get damaged, the other ones can still work, right? So, so we have the primary bronchi that go to the left side and the right side. Then those are going to divide again into the secondary bronchi. And this slide in front of you is not showing it really well, but the secondary bronchi go into each lobe. So primary bronchi is dividing like left and right. Then it divides again into the secondary bronchi, which go into each lobe. Once they're in the lobe, it divides again into tertiary bronchi, right? And that just means 1, 2, 3, right? Primary, secondary, tertiary. And it's going to divide again into bronchioles. Bronchioles are usually the first place where, if you have any kind of constriction, or if you have any kind of blockage, this is where you're going to feel it. It's small enough now that that's where you notice the air is having a difficult time passing through, if there's any problem. Then those end with terminal bronchioles. And then actually it goes a step further than this slide is showing. From terminal bronchioles, there's going to be something called, let me see if it's on the next slide. No. From terminal bronchioles, there's a final end that's called the alveolus or alveoli. So there's an end to it all. Let me go back a couple slides. So that's it. It's like this: trachea, primary, secondary, tertiary bronchi, bronchioles, terminal bronchioles. Some people would add respiratory bronchioles, but whatever. Terminal bronchioles, alveoli. Notice the diaphragm right here underneath the lungs. So that's going to be very important when we talk about physiology, respiratory physiology. I have no idea why I included this slide here. Maybe it's to show you the pleura. So if you remember, the heart has like a sac around it. So you have the pericardium, and you have a visceral layer that's really close to the heart and a parietal layer, which is further from the heart. Same thing here, but here it's not pericardium, it's called pleura. So right here. So you've got a visceral layer attached to the lung, and you have a parietal layer that's like right here, and then you have fluid in between that. So same setup as the heart. Just like in the heart, you have pericardial fluid. With the lungs, you have pleural fluid. Just like the heart, you can get pericarditis, the inflammation of it. Here you can get pleuritis. And it also is going to hurt a lot, right? Just in a different place. So it's probably why I have this slide on here. Here's your heart. There is the chordae tendineae. All right, we're not on that now, but here's a ventricle. All right. So again, it's lobed. 3 on one side, 2 lobes on the other side. Okay, here's the alveoli. So this is where gas exchange happens. This is the end of the line for oxygen. You're breathing in oxygen, breathing it in through your mouth and nose. It keeps going down, bronchi, down to bronchioles, gets smaller and smaller. It ends here at the alveoli. And you notice that the alveoli are covered with blood vessels, so pulmonary capillaries. So this is where the oxygen enters the blood and the carbon dioxide goes from the blood into the alveolus. So this is where you have gas exchange. So in the alveoli, there's 2 types of cells. So type 1, nothing very special about that. Type 2, which are septal cells, they produce surfactant. And so as I wrote here, it lowers the surface tension in the alveoli. So what does that mean? So here's like a larger shot of the alveolus. Here's like a blood capillary, respiratory, pulmonary capillary going around it. And so you have oxygen moving from here across to the blood, right? And so it has to be moist inside the lung, right? You can't have it dry. It's got to be moist. But at the same time, water has a surface tension. And so, like when you belly flop into a pool, like it hurts, right? It can act like water can act like a hard surface. So we want to keep it moist, but we don't want the oxygen to act as a barrier. Not the oxygen. You don't want the water to act as a barrier, preventing the oxygen from moving into the blood, and carbon dioxide moving from the blood into the alveolus. So septal cells produce surfactant, and surfactant lowers the surface tension. This is actually the reason why when you study pediatrics, for those of you going into nursing, that's going to suck. That's going to be like one of the hardest chapters that you study, so just be prepared for it. But one of the reasons why, the whole issue with being born premature is all about lung development, right? So, now we can go back early as 24 weeks, but if it weren't for the lungs, we could probably go back even sooner. You could probably be born even more premature. The whole issue with premature babies is the lungs. The lungs aren't developed. And the whole issue with the lungs not being developed is that the septal cells aren't developed. So they're not producing surfactant, and the surface tension's not getting lowered, and so oxygen's not able to enter the blood just yet. So if a baby's born premature and has to be put on some kind of respirator, or ventilator, that's the issue. That was the last slide. Okay, very last thing, the respiratory membrane. So the respiratory membrane is the membrane by which oxygen and carbon dioxide pass, right? So all it is you have one layer of epithelial cells. So this is lined with epithelial cells. Like you can see a cell here, you can see a cell here, right? And if you remember, epithelial cells are attached to a basement membrane. And you also have the endothelium of the blood vessel, and that's attached to a basement membrane. So you're going through the epithelial tissue of the alveolus and its basement membrane, and the same thing for the blood. Then you're moving through the basement membrane of the blood vessel and then the endothelial cells of the blood vessel. And that's the respiratory membrane. So that is an introduction. If you have any questions, let me know.